evening. My name is Jeannie Fournier, and I'm the Executive Director at the Diabetes Foundation. Welcome to our Diabetes Care Month. Tonight is the last of our 4-week series, and we're going to be discussing finding affordable diabetes care. As you know, the need to manage your blood sugar is key in order to delay or prevent long-term complications due to diabetes. And the cost of care can add up, making the financial aspect of diabetes a challenge. Our experts tonight have gathered to share their insights and their expertise to help you identify where in your local communities you can find food, insurance, healthcare, medication, monitoring supplies, and support at a cost that you can afford. My hope and that of our trustees is that our session tonight will inspire you to contact us on behalf of yourself, a family member, or a patient who may need help and care. Before I turn the session over to our moderator, Laura Vetter, I want to encourage you to please utilize the Q&A function on your screen to ask questions that may come to mind throughout the program. We will address as many as we can before the end of today's session, and we'll follow up with answers to the remaining questions following the program. I also want to thank our diabetes care sponsors for their generosity. With your help, we're able to provide this session and all of our programs for free. Thank you to BD, Essentia, M&T Bank, the Russell Berry Foundation, the Healthcare Foundation of New Jersey, Horizon Foundation for New Jersey, Sanofi, BioReference, George Link Charitable Trust, the Association of Diabetes Care and Education Specialists, Bergen Newbridge Medical Center, Wegmans, the Nanette Empney Bryan Foundation, and the S. Rubenstein Family Foundation. As I mentioned earlier, Laura Vetter is our moderator for tonight's session. Laura is the outpatient dietitian for St. Peter's University Hospital. She's a nutrition expert with 24 years of experience promoting health and nutrition education through focused consultations, community outreach, social media, and news outlets. At St. Peter's, in addition to conducting nutrition assessments for clients, she serves as the marketing and media department's nutrition expert. And Laura additionally works closely with the St. Peter's Community Health Services and Community Outreach Department, speaking at private and corporate engagements, health fairs, and community activities to promote well-being. Thank you, Laura, very much for volunteering your time to us tonight and for leading us in our session.
Thank you, Janine. It is my absolute pleasure to be here, and thank you for the invitation to host today's event. Diabetes management can be stressful, but it doesn't always have to be so hard. Throughout the COVID-19 pandemic and beyond, the Diabetes Foundation's main goal has always been to remove the barriers to care for the almost 1 million people living with diabetes in the state of New Jersey. Central to appropriate diabetes management is proper nutrition, access to care, and of course, sufficient support for those living with diabetes. This virtual program will help identify and access the resources and support available throughout New Jersey for those living with diabetes, and to ensure that you will never be alone in your efforts to properly manage diabetes. The Diabetes Foundation and our partners will use this evening to help participants understand the information they need to know the vital services that can take some of the stress out of living with diabetes. Before we get to our first speaker, we are going to launch a poll for our first poll for today. We ask that you answer the poll as it pops up on your screen, and we will leave this poll open for several minutes, and we'll share the results toward the end of the program today. Our first poll is a yes or no, and the statement or question is, I can afford my diabetes care. So if you could just take a moment to answer that question, and then we will move on to our first speaker shortly. And while everyone's finishing up answering that question, I would like to introduce you to our first speaker. Our first speaker tonight is Jeannie Fournier. Jeannie provides the strategic development and leadership for the programs of the Community Food Bank of New Jersey. These programs are focused on providing nutritious food to meet the immediate needs, as well as efforts to shorten the line and create food security. Jeannie has built and led large-scale programs for over 18 years, previously serving as the senior director at the Food Bank for New York City, where she oversaw nutrition and capacity building efforts for schools and community-based organizations citywide. Jeannie is a graduate of William Patterson University and a Master Certified Health Education Specialist. Without further delay, Jeannie.
Hi, good evening, everybody. Next slide, please. On September 30th, the Community Food Bank of New Jersey released a special report about the impact of COVID-19 on hunger in New Jersey. It was titled COVID-19's Impact on Food Insecurity in New Jersey. And it was looking at statistical projections to examine what increases we may expect in food insecurity across the state in 2020, and to advance recommendations for the public and nonprofit sectors to address this urgent need. As you can see by the map, New Jersey is estimated to have experienced a 56% increase in food insecurity due to COVID-19, which is higher than our neighboring states and the national average. COVID-19 presented a perfect storm of increased need, declines in donations of food, and disruptions to the charitable food assistance operating model. It's estimated that approximately 4 in 10 individuals being served are new to the charitable food assistance. The Community Food Bank of New Jersey is committed to supporting our neighbors in need with food and resources during the recovery, and doing so with an eye towards those most disproportionately affected by the pandemic and its impacts. Next slide, please. Lacking consistent access to adequate food to sustain an active and healthy life has profound impacts on individuals. We know that hunger's devastating effects affect social, behavioral, and emotional wellness, ultimately impacting community well-being. The mission of the Community Food Bank of New Jersey is to fight hunger and poverty in New Jersey by assisting those in need and seeking long-term solutions. We engage, educate, and empower all sectors of society and work to fill the emptiness caused by hunger with food, help, and hope. Next slide, please. Our approach is holistic, with a recognition that we're here to meet the needs of today while addressing solutions to bring change for tomorrow. Community Food Bank of New Jersey serves 15 of New Jersey's 21 counties, providing food and resources. We do this through a number of different efforts. Our Feed the Line efforts focuses on providing food to program partners throughout the state. About half of our food is donated, but the rest is purchased or provided by the government. We prepare healthy meals to address specific needs of children, seniors, and we work to address diabetic patients' needs as well. From a health perspective, we work to focus on hunger as a health issue and strive to distribute more fresh produce, lean proteins, and whole grains. We offer disease-specific food boxes to address chronic conditions such as diabetes and provide nutrition and healthy eating education classes. We also work to provide our struggling neighbors with SNAP application assistance, as well as home energy assistance, job training, and other resources essential to earning a sustainable living. And we work with local and state government on long-term solutions to hunger. And last but certainly not least, we work to engage corporate, faith-based, and government partners, as well as individuals and the general public through awareness campaigns, volunteerism, policy, advocacy, and community partnerships to ensure that all areas of society help us to fight against hunger. Last slide, please. One of the things I'm excited to share with all of you today is that you can easily find local food resources within the Community Food Bank's network. We work to provide nutritious food, including shelf-stable items and fresh produce, as well as additional wraparound program efforts. including connection to benefits such as SNAP and home energy assistance, as well as job training opportunities and nutrition education. This partnership is with about 1,000 partner agencies across 11 counties directly. And this includes soup kitchens, food pantries, shelters, after-school programs, summer camps, senior programs, and more. So a way that anyone can easily find some of our local program partners is either via our website, cfbnj.org/findfood, or by texting the number 908-224-7775. And you can either text find food for English or comida for Spanish. I hope that this is helpful for you in identifying some local resources, and happy to talk with you at the end of this in case you have any questions. Thank you so much.
Thank you, Jeannie, for that enlightening presentation. Being a dietitian, food security is a main focus for myself also. And just a reminder that if you do have any questions, we encourage you to use the Q&A feature on the bottom of your screen to type in your questions that we will be getting to later on in the presentation. Our next speaker tonight is Gabrielle Escribano. Gabrielle is the bilingual ACA Outreach Coordinator and Certified Application Counselor from the New Jersey Citizen Action Education Fund. She has years of experience working in the nonprofit and social sectors and is a passionate advocate for educating the public about the assistance programs available to them. Gabrielle, welcome.
Thank you so much for that introduction, Laura. All right, so today we're going to dive into COVID-19 special enrollment period. So it's very important that we obtain health insurance to maintain our health or possibly maintain the medicine that we are currently on. Thankfully, the special enrollment period has been extended to December 31st. This means we have all year to obtain health insurance. Now, of course, we have until the end of December, but I do stress the importance of trying to obtain health insurance as soon as possible so like that you are able to maintain your health and possibly prevent any major illnesses from happening. So what are those eligibility requirements? You must be an uninsured resident in New Jersey, or an uninsured dependent residing in New Jersey, or you have health insurance and you are not happy with your with how much you're paying on a premium basis. You could possibly qualify for affordable health insurance through the Get Covered New Jersey. Now, if you already have health insurance through the Get Covered New Jersey, but you're noticing that it's not meeting your needs, especially as a diabetic, it's very important to make sure your health insurance is meeting your needs. You have until the end of this year to change the health insurance to find something better. Now, these health insurances through the Get Covered New Jersey portal are based on an income and household size. So when you have a major change happening, it's super important to report these things, such as an increase of income, a decrease of income, changing your immigration status, if you're getting married, divorce. Something new is pregnancy. And of course, if you are no longer eligible for New Jersey Family Care, there is no worries. You can go right through Get Covered New Jersey and you can possibly obtain some affordable health insurance. Something to note is that just because it's called the COVID-19 special enrollment period does not mean that you have to bring some sort of documentation regarding COVID-19. So you don't have to be impacted directly by COVID in order for you to qualify for this assistance. Next slide. Can I have the next slide? Thank you. All right, so this is some really exciting news. At least it made me very excited. It is called the American Rescue Plan Act of 2021. So when that stimulus package came in, what also came in for us New Jerseyans was the more financial help to reduce these monthly premium payments. This is huge. So if you're an existing consumer, as of right now, you have that affordable health insurance, all you have to do is resubmit your application and you're going to see the new financial subsidies. Let's say that you applied, but you chose not to grab any health insurance plan, then Get Covered New Jersey will automatically update your financial assistance. So, guys, it's super important. Go back into that application and resubmit that application. So, new consumers or people who have applied in in January, and they just weren't happy with the estimate that they received, this is the time to reapply. Uh, the new financial subsidies were started in April 15th. So again, if you applied before April 15th and you were not happy with your estimate, you may be happy now and you might qualify. So give it a try. Now, if you do enroll by the end of May 31st, your coverage does start by June 1st, and vice versa. If you obtain your health insurance by June 30th, then you would have health insurance by July 1st. Please keep in mind that if you do obtain your health insurance May 31st, you may want to give it a week or so before you do receive your health insurance cards. So unemployment compensation, what does this mean to you? Let's say, again, you tried to apply for New Jersey Family Care beginning of the year and you did not qualify. You tried to apply for affordable health insurance, and you did not qualify. So important that you go back into your account and you give it another try. This new financial subsidy has unemployment individuals. They're eligible for nearly $0 to $1 help, free coverage. So, for example, I just helped someone who was receiving a premium of $200, and now he's going to be paying 57 cents. So, give it a try. If you're going to do these things on your own, it's super important that you go into your account, you resubmit your application, because the unemployment question must be answered in order to receive these benefits. You can go on to the next slide. And this is where we're going to talk about your health insurance options. So if you go through the Get Covered New Jersey marketplace, it will let you know whether or not you qualify for New Jersey Family Care. However, it does not make the final determination. What it will do is it'll take your application and it will send it directly to New Jersey Family Care if it feels like that's where your application belongs. You can always apply for New Jersey Family Care all year long. So never worry about that. Now, again, if you go through Get Covered New Jersey, this is a good one-time shop. You can go through here, see what financial subsidies you are eligible for. And they do currently have Horizon Blue Cross Blue Shield, AmeriHealth New Jersey, Oscar Health, and then they have them in separate categories such as bronze, silver, platinum, gold, and catastrophic. There is no extra cost for you to find an assister and for us to assist you to navigate through the Get Covered New Jersey. I do suggest that you try to find an assister. One simple mistake could possibly change your financial subsidies. So we are available here for you. We speak English, Spanish, and Hindi. Thank you so much. And I'll answer any questions that anyone has at the end of the presentation.
Thank you, Gabrielle, for that insightful information. And yes, again, please type your questions into the Q&A on the bottom of your screen so that we could get to all those questions shortly. Before we get to our final speaker of today's program, we would like to launch our second poll for today. This question allows for multiple answers. So select the answer you feel most comfortable and which is most appropriate for you. And it reads, I am most concerned with the following related to my diabetes: healthy eating, monitoring, medication management, and stress and coping. And while everyone is taking the opportunity to answer that, I would like to introduce you to our final speaker for the evening. Our final speaker is Marlene Korngold. Marlene is the Participant Healthcare Solutions Lead for the Diabetes Foundation. Marlene has been living with type 1 diabetes for about 30 years, which began as a diagnosis of gestational diabetes. She had a successful career in advertising and spent time raising 2 amazing and successful sons. Having diabetes never stopped her from being independent and a career woman. She maintains her diabetes and a great level of health and wellness through support from healthcare team that has led her down the right path. Marlene is very active and an extremely positive person. She believes fighting all the ups and downs of living with diabetes. She has found her true passion in helping others living with diabetes through the Diabetes Foundation. Marlene finds helping others in need of support and affordable resources extremely rewarding. She knows what it's like to be in the dark with diabetes, and her goal is to help give others hope and inspiration to live healthy and happy. Marlene.
Thank you so much for such a lovely introduction. And I'm ready to go to the next slide. Thank you. So yes, living with diabetes, I have some personal comments that I'll make throughout. And as a person living with diabetes, I know how hard it is. And the most important thing really is reducing risk for any complications with diabetes. I have been super lucky because I take care of myself to the utmost. And I'm going to share with you some of the ways that have been actually most successful for me as well. If you follow these 7 areas of diabetes care, it will really be so worth your while. The first 2 that I want to tell you about are super important. Is first, finding and visiting your endocrinologist to manage your diabetes. Along with that, very, very important to see a certified diabetes educator. A certified diabetes educator will work with you one-on-one to manage and maintain your glucose levels, what you're eating, how much insulin or medication you're taking, and she will or he will work with you and give you so much time to figure out what you need personally, because everybody with diabetes has a different case, and very important. It's very important as well to monitor your heart health with a cardiologist. If you have any underlying conditions or family history, it's of the utmost importance to see a cardiologist, and he will instruct you from there, and a nephrologist for kidney care. Any problems, any things that arise, you must see a nephrologist for the best care there. As far as your feet go, foot care is so important, and you should see a podiatrist in your local community. Healthy feet are so important. And when you meet with a podiatrist, he will then or she will explain to you how often you should be seeing them. You need to go to an ophthalmologist for a thorough eye exam. You will need to do this at least once a year to maintain healthy eyes. It's very, very important to also visit your dentist for good hygiene and good care of your teeth. Very important. Every 6 months, you should go for a teeth cleaning and a full checkup. Next slide, please. Thank you. We're going to talk a little bit about medication and monitoring. So the key components for diabetes care. Number 1, you want to go and get your A1C tested every 3 months. I do that, and I'm happy to report with you guys. I had the most amazing visit yesterday, actually, with my diabetes educator. I had a 6.6 A1C. That was my best ever. So I am so thrilled to share that with you. And the reason that it is a 6.6 is because I am determined to live till at least 100 years old with no complications. And I'm here to tell you that if you can manage your A1C every 3 months, get your A1C test. You go to a lab and you get your tests done there, along with any other test that your doctor will give you a prescription for. And every 3 months, you should be seeing your certified diabetes educator to talk about what your A1C was. If it was a bit high, how are you going to control that to bring it down? What are you going to do? Now, before you see your certified diabetes educator, I recommend at least 3 to 5 days of keeping a log of what your blood sugars are. For example, one day you take your blood sugar on a fasting. When you get up in the morning, you have your blood sugar, what you ate for breakfast. And the safe way to test is 2 hours after you eat a meal. You want to keep records of 3 days at least before you see your certified diabetes educator, because that will give your healthcare provider an indication as to what's making your blood sugars rise or fall. So it's very, very important to do that. Now, when we talk next about the high and low blood sugars, let's talk about the low blood sugars. So when you're taking insulin or you're taking oral medications, your blood sugar could drop to a low level where you go hypoglycemic. That means that your blood sugar is dropping too low and you're going below 80. If you're going below 80, you need to have a plan in place, an emergency plan. There are over-the-counter glucose tablets that are available, and they are pretty inexpensive for a large bottle, and they have little sleeves you should always take with you wherever you go and keep it in your car. These are emergency tips. And you'll go over this with your educator, and she'll tell you when your blood sugar drops to XYZ level, this is how many tablets you should take. So that's important to discuss when you're on medication or insulin. The other is when your blood sugar is going too high. You don't want to maintain high blood sugars. It could complicate your different situations that we want to avoid. Let's just say that you don't want to be high. So you want to know, if you're taking insulin, what is your correction level at different times of the day? How much insulin should I take to bring myself down to a safe level? This needs to be discussed with your endocrinologist or educator. If you're on oral medications, you need to know what to do. So those are very important. And exercise is key also to a healthy life. I'm a big proponent of exercise. I exercise all the time, and it is wonderful. When your blood sugars go high, exercise can bring it lower. So you can go for a brisk walk. But again, discuss this with your educator. Next slide, please. So now we're going to talk about support and coping programs and things like that. And look, I'll be honest, one thing that I have learned is that your family and your friends should know and understand your condition. I always like to say diabetes is a condition. It's not a disease. Let's call it a condition. It's easier and it's a more friendly word. Okay, so if you have this condition, let your friends know. What are the danger signals if my blood sugar drops? What can I do to help you? As well as your family members, because support starts with your friends and family. After that, there's the JDRF. They are a wonderful organization, and they help people with type 1 diabetes. They offer support groups. They also offer some wonderful webinars, and it's a terrific nonprofit group, and they are a national organization. There's the College Diabetes Network. If you're going to college, I would encourage you to find out at your local college, do they have a college diabetes network? And guess what? If they don't, you can start your own. How cool would that be? So it's a wonderful place for people to support each other with diabetes. There's Diabetes Sisters, which is all over the state. They're doing virtual meetups, and they also have support groups in the communities. Now, don't forget your doctor's office, or there are outpatient hospital support groups. Ask them. I know at my doctor's office, they have a big sign that they offer support groups. So see if you can take advantage of that. Also, I am hosting a adult support group. It's wonderful. Little bias, of course. It's called From My Living Room to Yours. And we just started the first one a couple weeks back, and it was really great. It's just a nice place for people with things in common that we can speak about. You know, we can talk about our challenges, what we're looking for tips and help with. So I encourage you to check that out. We also have a youth support group through the foundation, through Diabetes Foundation, and that's for teens, young adults in college, and also moms and their kids. So it's wonderful. I can't impress upon you enough how support groups could be such a nice way. Next slide, please. And now we're going to talk about resources for healthcare and medication. For long-term healthcare, you can, if you are underinsured or uninsured, you can go to a federally qualified healthcare clinic. When you go to one of these clinics, first of all, they have them all over the state of New Jersey, and there are quite a few in each county. When you go to one, you would be seeing a primary care doctor to get help with your overall health, diabetes, and another help as well. You can also get free and affordable medications through a federally qualified healthcare clinic. They have pharmacies that they will tell you where to go to get really good pricing. This is all income-based and sliding scale based. Then there are free and charitable clinics, and they have them again throughout New Jersey, and you would see a doctor, and you could also, which is really nice, get discounted medications, which is terrific. Then there's also charity care, and charity care is offered through hospitals where you would actually apply, and they have clinics where you could go to a doctor. You can't necessarily get medication through that, but there is help where you could see certified diabetes educators through these clinics, and doctors as well. For oral medication programs, there is Walmart, ShopRite, RX Outreach, and Prescription Hope. These are some wonderful discount programs for oral medications. And then we have pharmaceutical programs, and this is for insulin and other medications. So for example, Eli Lilly, they make Humalog, which is an insulin that is fast acting. They make quite a few others, but what they have started since COVID-19 is that they started a program where it's a solution center. You can call them and they can help you to figure out how to download a copay card. And this is for insured and uninsured. I happen to have used it and it was really great. I needed just a month's supply of insulin. I had a situation and I didn't need a full 90-day supply. So I was able to work with the solution specialist over there, and I downloaded the coupon. My doctor called in the prescription to CVS or any local pharmacy. You can do it. And I was able to pay $35 for my insulin for 1 month. So I really encourage you to take advantage of that. And each one, Eli Lilly, Novo Nordisk, and Sanofi have copay cards if you are insured, so you don't have to pay as much if your copay is high. And if you don't have insurance, this is only if you don't have insurance, you could apply for a prescription assistance application. There is an application where you and your doctor would have to fill it out with prescriptions, and you could get the insulin at no cost or very low cost. When you're in the donut hole, if you have Medicare, you can also do this. And then, of course, if you're in an emergency crisis and you need short-term emergency medication, you can turn to our foundation, Diabetes Foundation, and we will give you up to 2 months of free medication. Next slide. We're continuing on with this subject. There are also coupons. You can use coupons to get lower discounted prices with GoodRx, Single Care, and New Jersey Drug. And then there are Novolin programs. Novolin is an insulin. I actually used it years ago. It came out before the faster acting insulins, but a lot of people are still using Novolin, which works fine. And you can get actually at Walmart pharmacy, you can get a vial of insulin there for $25. They call it Relion, which is Novolin. It's their own brand. And you don't even need a prescription. I know that sounds crazy, but it's true. So you know that, okay? You can also go through Reduced RX. You could download a Reduced RX savings card, and you will be able to get Novolin at many different pharmacies. Depending on your zip code, you can plug in your zip code and it'll spit out what pharmacy you can go to. You will need a prescription for this, and the Novolin is $25 a vial as well. Then, as far as diabetes supplies go, there are many different brands of test strips. We put up a few, but there are many. And for example, Contour Next, Freestyle, One Touch, they have savings programs as well. Now, CR3 Diabetes is a good nonprofit as well. If you're using, or if I should say, if you need an insulin pump but can't afford it, they have a financial application that you would need to apply for this assistance. And if you meet their financial guidelines, you could get a pump which is refurbished and works fine. And they will also be able to supply you with test strips. So this is not necessarily free, but more affordable, especially if your copays are out of sight or you are uninsured. Then, of course, there's the Diabetes Foundation. We have supply, you can get up to 2 months of supplies. We can help with CGM sensors. We can help with pump supplies and strips and many others. So that's for up to 2 months. And that would be on our website, all of this. Next slide. And that will conclude my presentation. Thank you. And I'm happy to answer any questions after. I appreciate it and look forward to speaking to some of you in the future. Thank you.
Thank you very much, Marlene. That was wonderful. And congratulations on that A1C. I always love to hear the good that people see in their blood sugars and their lab results too. With the time that we have left, our panel is happy to take questions. We have received a lot of great questions in the Q&A. Keep them coming. And to note that we will try to get to as many questions as we can, yet if we don't answer your question live tonight, we will be following up with you with the answers to your questions. So if I could ask the panelists to come back into view, and we will get to some questions. And for the panelists, please feel free to take the question. I will direct some to you because some were more specific for each person that spoke. So the first question that I wanted to put out there for the group was for you, Jeannie, and it's regarding the minimum qualifications to receive services from the community food bank.
Sure, thank you so much. So accessing your local food pantry or soup kitchen or any community-based program that may be one of our partners going to one of those sites and stating what your current needs are is really the main criteria right now. We know that the pandemic has impacted so many of our neighbors throughout New Jersey. And so our goal and our partner's goal is to make sure that we're connecting anybody who has a demonstrated need for food services with those services.
Great, thank you very much. And the second one I'm going to throw out to Gabrielle. This question is, can you qualify for the New Jersey Family Care if you are not a citizen?
Absolutely, you can qualify as long as you've upheld your immigration status for the last 5 years.
Okay, and if someone has been, they had their immigration status held for 3 years, what would that entail for that person?
So what that would entail is to go through Get Covered New Jersey, and they would qualify for some sort of financial subsidy through the Get Covered New Jersey marketplace, just not the New Jersey Family Care Program. Thank you so much. Great question.
Thank you. Yes, thank you for these questions that are coming in. Marlene, a question that I'm going to ask you. However, I have a feeling Gabrielle can also jump in on the answer to this one. And I'm asking you, Marlene, because you had brought it up early on in your talk, was about dental health. And I know many people will focus care on their blood sugars and not on that need for that whole picture of medical care, whether it's the nephrologist for their kidneys or the dentist. And how do you see dental health fitting into this big picture? And what about the access to care for dental coverage for people?
I'm just going to talk about the first half, and then I'll let Gabrielle take it from there. I will say that when you keep your teeth in good health, it will cause less complications with everything in your total health for the future. So it affects everything. So let me give you an example. If let's just say you have some pain in a tooth, okay, and you're avoiding going to the dentist for reasons, maybe you can't afford it, and Gabrielle will talk about it, but your blood sugars will go high whenever you're in any kind of duress or pain. So the key thing is you want to avoid pain and you want to keep your teeth healthy because you do not want your blood sugars to spike. Okay.
Yep. So I have to actually piggyback off of what she said, because you have to maintain your health. So there is dental coverage available through the Get Covered New Jersey. It would be separate from your medical health insurance, but it's there to maintain those teeth. And when we all know when we get that bad pain, everything else seems to just kind of follow suit with how we end up feeling in that day. So definitely maintain your teeth, eye vision as well. That would be separately. But I want to say the most that I've seen for dental health coverage thus far has been $20. So it is affordable through the Get Covered New Jersey marketplace.
Thank you both for helping with that answer. And along with our dental care, as you just mentioned, Gabrielle, a question came up with food regarding not only dental health, but for visiting a food bank and receiving the food items that they feel are appropriate for their diabetes care. Is there any way, Jeannie, with going to a food bank, that clients can request foods that they are comfortable with for their diabetes care?
Absolutely. So as I had mentioned earlier, we work with a whole host of different programs. Every program looks a little bit different. Our goal is certainly to offer client choice so that you have a number of options from which you can choose, which also gives you the ability to look at specific criteria to make sure you can manage your diabetes. I will note that the pandemic has made it very challenging for some sites to be able to still offer the ability to go through and look at specific items. Now that the weather is getting nicer, and I know some of our sites are working to do outdoor distributions again. I can't say exactly what every single site will be doing, but what I would encourage anybody to do is to talk with the staff at the local pantry. Let them know what your concerns are, what your needs are, and they will work to make sure that they can provide you with food items that are available. And if anybody ever has any questions as well, or wants additional, just resources on some of our programs, you can always feel free to call our food assistance line, and I'll make sure I pop the number in here as well, but I'll just state it. It's 908-838-4831. And that team who staffs that line will be able to help you not only with any food assistance questions you have, but if you have any questions about potential eligibility that you may have, particularly during the pandemic, either with SNAP benefits or home energy assistance, our team can provide that resource to you as well.
Great, thank you. And we had a question regarding, and Marlene, this is probably for you. Are there options from the Diabetes Foundation if I need more than 2 months worth of medication? And how would a possible extension work?
Okay, so during COVID, we have extended our services. So and the point is being that it was getting insurance sometimes took a little bit longer. There was just so many extenuating circumstances. So we decided that if someone needs more than 2 months and they are having so much difficulty with bridging this gap, let's just say, or they are just in a very tough spot, we will definitely be able to give them more assistance. It's usually another month, but it could be a month or two, possibly, depending on what that person is in need of. And at that point, we will also decide, there are so many great resources out there that people don't know about. So we'll work with those people one-on-one and see what option would work best for them.
Thank you. And another question that we had was regarding someone who is a truck driver and he does finger stick for blood glucose monitoring. Yet they're interested in looking into how to obtain a continuous glucose monitor, a CGM, versus the finger sticks. Does anyone know of any resources for switching from finger sticks to a CGM?
So that's a very tricky, tough question. CGMs are very new to the market. It's like a few years old, right? And so the two brands out there right now, or there's three, is Dexcom. It's Medtronic has their own, okay? And there's Abbott Freestyle. So there's three different kinds. And they do offer some different kinds of financial help. When you go onto their websites, they have payment plans depending on what you have for insurance. So with New Jersey Family Care, they have great options. But if you don't have insurance and you really want to switch from finger sticks to a CGM, it may be hard to do. And that's why we all encourage people getting some kind of insurance that can really help. That, as Gabrielle mentioned, there's so many tax credits today and there's so many options, and so many people that I talk to get so scared away from insurance because they think their premiums are so high and things have changed so much. So I think it's really on a case-by-case basis. And I think that we can give really great advice and help for each different person's situation.
And can I actually piggyback off of that? I think it's really important before you speak to any representative that you know what your needs are. Do not wait for an assistant to continue to keep asking you, what is it you need? If you know this is the medicine that you want and this is what you need, the system itself will ask, do you have any prescriptions? So it's our job to make sure that we put in your needs, but if you don't speak up, you're going to end up with a health insurance that doesn't cover your specific needs. So really important to always write down exactly your what your why, and your how much can you actually really afford this. Okay.
Thank you both. I like how you just ended that, Gabrielle, with the what, the why, and the how, because I think that that's going to be an important answer or segue to an answer for another question that we have, not necessarily on the same topic though. So we have a question regarding tips for blood sugar drops away from home. So our attendee had a question regarding the fear of a diabetes emergency happening when they are doing an activity that they love and camping, and how can they assure themselves that they have all their bases covered. And I think that those three questions, as you just mentioned, Gabrielle, could be addressed. Does anyone have any insight?
Yeah, I want to just say to you, or let people know that I travel, not a lot, but when I do travel, even if it's overnight, I will tell you that I always keep my emergency supplies with me on hand. And I always take glucose tablets. They make these little juice packs. They're like little kitty juice packs. And I like to get the ones that are not high in carbs. They make ones that are like 7 grams. So it's half the amount, of a serving, which is usually the 15, right? So I take with me little juice packs that are 7 grams. Now it depends, of course, how low your blood sugar goes. But let me tell you how important it is to always carry glucose tablets. It never goes bad. You carry a sleeve of them. They can be bought over the counter. And as far as how many should you take, I would discuss this with your certified diabetes educator, because each tablet is 4 grams. And depending on what your number is how many you should take. But you should always feel safe, because I always feel, I'll be honest with you, like a Girl Scout. I am so diligent, and no matter where I go, I have things in my pocketbook. I have things in my glove compartment in my car. And let me tell you, after 30 years of having diabetes, I had to pull off the road and just calm down and have my glucose tablets until I was at a safe zone to drive again. These are things that are going to come up when you have diabetes and you're taking insulin. It's a challenge, and you have to know how to treat it. And it's very, very important.
Thank you. And our last question is going to be for Jeannie. Jeannie, are there any resources for having people learn about cooking with diabetes?
Yes, absolutely. So we, Community Food Bank of New Jersey's nutrition education team provides nutrition education classes, and they are focused on of course, learning about healthy eating, doing so in a way that is budget friendly. So shopping tips, as well as healthy recipes. I should also say delicious, right? So healthy and delicious recipes, as well as physical activity, right? With the whole idea that supporting your overall health and wellness is really the way to best manage any type of chronic illness you may have, such as diabetes. And so right now our team is able to do that virtually, as well as, get back out into the community. So we are happy to connect with anybody to offer virtual classes that we may be holding, as well as feature any community-based workshops that we're holding as well.
And can I also say something too about that? I just want to let people know, if they go to the Diabetes Foundation website, we have some really great cooking demonstrations and healthy recipes. And if somebody wanted to call our organization for support, I have many, many tips and many tricks to low carb eating and healthy eating. So there's so many resources out there.
I thank you all for your time this evening. And before we go back to Jeanine Salente for a final farewell, I would like to share the results of our 2 polls today. So the first one being, I can afford my diabetes care. And you'll see it was pretty much of a split, that 53% of people felt yes, comfortable with that. However, 47% felt no. And I hope that those of you who answered no to that now have the resources that you need to feel comfortable moving forward, and that you could reach out to the different organizations and the Diabetes Foundation so that we can help you change that answer to a yes. And our second poll is, I am most concerned with the following related to my diabetes. Again, we had a little bit of a split there. 61% being healthy eating, 58% being medication management, 48% being stress and coping, and 45% being monitoring. Similarly to that first answer, please reach out so that we can get you on the right track for your medication management, which in turn is healthy eating too. You know, the stress of diabetes, it's multifactorial, and we have to make sure that we have something for everyone so that everyone is comfortable. And I, again, hope with the panelists that you heard tonight, you have the hope that you can get this managed, and that we're here for you. So as we come to a close, I would like to bring back Jeannie Fournier from the Diabetes Foundation to offer our final farewell. And thank you all.
Thank you, Laura. On behalf of the Diabetes Foundation, I would like to thank tonight's speakers, Jeannie Fournier, Gabrielle Escribano, and Marlene Korngold, and Laura Really. Thank you so much for being our moderator today. The Diabetes Foundation, we developed Diabetes Care Month to ensure that every person living in the state who has diabetes has the care they need to live their healthiest life. And this past month has been an incredible 4 weeks talking about a multitude of different topics, and we will be hosting the series again in the spring, probably in February 2022. So if you want to learn about the date or the topics we're going to be discussing or more about the Diabetes Foundation, please come online on our website, www.diabetesfoundationinc.org. Sign up for our newsletter, sign up for free texts as well. And the Diabetes Foundation, we are here to help those living with diabetes across the state of New Jersey, and we offer free education and support programs in partnership with the most experienced medical, health, and wellness professionals. So really, whether you're at risk of developing diabetes, living with prediabetes, type 1, type 2, gestational diabetes, if you have a question, we have an answer. So please connect with us. Thank you again so much for joining us, and we look forward to seeing everyone next year.
Thank you.